Good morning, everyone. Welcome to the Joint Standing Committee on Labor and Housing. My name is Craig Hickman. I'm State Senator from Senate District 14, 11 towns in Southern Kennebec County, including my hometown of Winthrop. Today, we have briefings and presentations from the Workers' Compensation Board and Maine PERS. And somewhere in there, we will also have a public comment from Ms. Sue Halls if she shows up to discuss some issues that are germane to our work today. But before we begin, we will do committee introductions, and I'll go on my screen, beginning with Representative Geer.
Good morning, everyone. I'm Tracy Geer. I represent House District 9, which is Kennebunkport and Coastal Biddeford and Kennebunk.
Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent the towns of Turner, Leeds, and Livermore, and House District 75. Thank you.
Representative Cuddy.
Good morning. My name is Scott Cuddy. I represent House District 98, which is Winterport, Frankfort, Searsport, and Swanville, and I live in Winterport.
Representative Pebworth.
Good morning. I'm Sarah Pebworth. I represent House District 133, which are the lovely towns of Blue Hill, Brooklyn, Brooksville, Castaigne, Sedgwick, and Surrey.
Representative Drinkwater.
Good morning. From Gary Drinkwater, District 121.
Representative Warren.
Good morning. I'm Representative Sophie Warren, and I'm fortunate to represent my hometown in Scarborough, Maine.
Senator Garing.
Good morning. I'm Senator Stacey Guerin, representing Southern Penobscot County.
Representative Bradstreet.
Good morning. Good to see everybody. I'm Representative Dick Bradstreet, representing House District 80, my hometown of Vassalboro, Windsor, Somerville, and part of Augusta.
Good morning, all. We may have other committee members trickle in. With us today, we have Mr. Justin Purvis, our committee clerk, and our analyst, Mr. Stephen Langland. And with that, we are scheduled today. Mr. Langland, would you just like to tell us our agenda really quickly, and I will promote folks into our room so that they can do their work for us.
Sure. So first up, we have a report from the Workers' Compensation Board on PTSD, and that will be followed by several presentations from Maine Public Employees Retirement System, starting with the Government Evaluation Act, report related to LD 341 on WEP and GPO, and a 2021 actuarial evaluation on the State Employee and Teacher Retirement Program from the new Chief Executive Officer, Rebecca White.
Thank you, Mr. Langland. And so we will just get right into it. Presentations, I will admit, these are very extensive reports. I encourage all of our committee members to read them when you have an opportunity. I tried to get through all of them before this morning. I will admit that I did not, but we will allow the experts to guide us through them, and I'll be sure to read them all in detail as soon as possible. So with that, I'd like to welcome to the committee, Mr. John Rohde. And if you, sir, could introduce yourself, the Zoom is yours.
Sure. Thank you, Senator Hickman and members of the Joint Standing Committee on Labor and Housing. I am John Rohde, the Executive Director of the Workers' Compensation Board, and I'm here to present the board's report regarding the post-traumatic stress disorder presumption in Section 201, subsection 3A of the Workers' Compensation Act. So Section 201, subsection 3A addresses mental injuries caused by mental stress. These types of injuries have been long been compensable in Maine, and since 1987, there's been a separate statutory provision addressing these types of injuries. In 2017, this provision was amended to include a presumption that PTSD suffered by law enforcement officers, firefighters, and emergency medical services personnel is presumed to be work-related if the diagnosis of PTSD is made by a licensed psychiatrist or psychologist. The diagnosis is based upon a finding by that healthcare provider that the work stress was extraordinary and unusual compared to the average employee. And finally, that the work stress is the predominant cause of the PTSD and not some other source of stress in the person's life. The presumption can be rebutted by clear and convincing evidence to the contrary. Two other provisions of this subsection are that the board has to submit the report that's before you all today. And finally, this PTSD presumption is repealed October 1st of 2022. As you all probably remember, corrections officers and E911 dispatchers were added to the list of eligible employees effective in October of 2021. So it's too soon to know or to look at what impact there might be from that statutory change. And with that in mind, if I refer to, which I'm sure I will, first responders as a group, it will just be law enforcement officers, firefighters, and emergency medical services personnel, because those are the folks we took a look at in this report. So as contemplated by the statute, we put together a subcommittee so we could get some input. And joining us on that subcommittee were representatives of the Maine Municipal Association, as well as the State of Maine's Department of Administrative and Financial Services. We met 3 times this year, last year now, 2021, and there were several points that the group agreed upon in a general sense. The first being that PTSD among first responders is a serious problem, that early intervention by way of employee assistance programs, peer-to-peer communications, and when necessary, medical treatment are important tools to ameliorate the impact of PTSD amongst first responders. Enactment of the presumption has not resulted in more claims being compensable than would have been the case if the presumption was not in the law. Since the presumption was enacted in 2017, employee assistance and peer-to-peer options have increased for first responders. Enactment of the presumption has played a role in increasing awareness of and reducing the stigma associated with PTSD amongst first responders. The number of PTSD claims filed with the board has increased since the PTSD presumption was enacted in 2017, and a smaller percentage of these claims are being pursued after being initially denied. Those latter 2 points I'll talk a little bit more about in a few minutes. To gather the data that we needed to produce the report, we looked at 2 periods. The presumption went into effect November 1st of 2017. So we looked from 2017, of course, until just about the end of October of 2021. That's the post-presumption period. We picked a similar period of about 4 years from 2013 to 2017, which I'll refer to as the pre-presumption period. To identify the relevant claims, we looked at the occupation that is sent to the board on a first report of injury. That's the first document that comes in normally on a claim. We broke those down into firefighter, law enforcement officer, and emergency medical personnel. Some come in firefighter and emergency medical personnel. Those were all categorized as firefighters. As far as identifying the injuries that we thought would be relevant to this report, because the first report of injury is usually the first document and it's usually filed early in the claim, oftentimes a diagnosis won't be available when that document is filed. So to be as inclusive as possible, we selected claims that looked like they were likely to involve PTSD. Stress, anxiety, PTSD showed up. That made it easy, of course. So we can't be sure how many of these claims would actually meet the definition of the presumption where there was a specific diagnosis from a licensed healthcare provider and so forth, but we wanted to be inclusive in looking at the data. So with respect to the data itself, in terms of the number of claims, on page 4 of the report, there is a chart showing that in the pre-presumption period, 56 claims for PTSD were filed with the board. In the post-presumption claim, that number was 128. We also looked at the first reports for the descriptions of injuries to see if the nature of the claims being reported to the board had changed in any respect. We broke them down into general categories because many of these first reports involve unique incidents. And if we describe the incident itself, it could lead to identification of the folks involved, and therefore we wouldn't be protecting their confidentiality. So you will see on page 5, there's a chart showing that the types of claims being reported hasn't changed materially. Most of them describe a specific event or a cumulative effect of several different events. So the nature of the claims being reported to the board didn't change from the pre to the post presumption period. We're also required by the statutory provisions to look at how many claims ended up with a decree or a settlement, or it says, I think, an agreement or a settlement, award or settlement. In the comp system, if the parties agree that they want to resolve a claim for all time, they'll enter into a lump sum settlement agreement that closes off the claim in exchange for usually some form of a monetary compensation. An award can come in one of two ways. Here, it would be a decree issued by a judge after a contested case, or it could be a consent decree where the parties have agreed on how the case should be resolved, and that's submitted to a judge, administrative law judge, who then signs it. The charts with respect to the decrees and lump sum settlements are on pages 6 and 7 of the report. In the pre-presumption period, 43% of the claims wound up having an award or a settlement. In the post-presumption period, that number is only 14%. And in both cases, they're roughly evenly distributed between decrees and lump sum settlements. So, as I mentioned a little earlier, when a claim for lost time is filed with an insurer or self-insurer, that claim administrator, to speak generally, will either deny the claim and file a notice of controversy, or agree to make payments voluntarily or otherwise and file a memorandum of payment. We took a look at the cases that had come in pre and post presumption that were initially denied to see what percentage of those claims ultimately had a payment made on them. Those charts are on page 8 of the report. And what you'll see there is that in the pre-presumption period, 50% of the claims that were initially denied ended up having a payment being made, compared to 28% in the post-presumption period. We took a look at finally costs from two respects. One would be benefit costs reported to the Workers' Compensation Board. Those would be payments for missed time from work, medical expenses, other expenses, defense attorney costs, as you'll see in the report there. On page 9 is where that information can be found, and there's a chart showing that in the pre-presumption period for the claims that were reported to the board, approximately $3 million in total was reported as having been paid on these claims. That worked out to an average of about $54,000 per claim. In the post-presumption period, approximately $2.4 million has been reported to the board so far, and that works out to about $17,000 per claim on average. The other aspect of looking at costs was costs to the state and its political subdivisions. The board doesn't collect data regarding premiums that are paid by employers, how much an employer is paying for their particular policy. But the Maine Municipal Association told us that their member contributions, which are the equivalent of a premium payment for an insured employer, increased by a little over $1.8 million over the most recent 3-year period in time before the report was drafted and filed. Those increases are largely being paid by entities that have experienced post-traumatic stress disorder claims that they are paying for their first responders. So to conclude, what you'll see in the report is that the number of claims filed with the board has increased since the presumption was enacted, but the percentage of claims where a payment is ultimately being made has decreased. Overall costs are approximately the same in the pre and post presumption periods, but the average cost per claim has decreased. And as you'll see in the end of the report in 2017, my predecessor, Executive Director Paul Signolfi, had testified in favor of the presumption on behalf of the board because of the importance of early diagnosis and treatment of these types of injuries. And hopefully what we're seeing in this report, in the data and the information that you'll see in there, is that this goal of early intervention and treatment is being realized. And with that, I thank you for your time this morning, and I'm happy to try to answer any questions you might have.
Thank you, Director Rohde. Before I call on the committee, I see a few more folks have joined us. So Representative Rader, if you would like to introduce yourself.
Sure. My name is Amy Rader, and I represent District 125, which is a portion of Bangor. Thank you.
And Chairman Sylvester. If he is.
Thank you. I don't have enough bandwidth in order to get video on. I'm just holding on here, but I am Representative Mike Sylvester, and I represent District 39, which is the Eastern Peninsula portion of Portland and the Fighting Frigid Islands of Casco Bay.
Thank you. And so we will now take questions from the committee for the director. First up is Representative Cuddy, followed by Representative Gear, Representative Bradstreet.
Thank you, Senator, and thank you, Director Rhodey, for the presentation of the report this morning. My question is on the cost, because looking at the number of cases and the fact that there was a presumption that it was workers' compensation related, I expected, as I was going through the report, costs were going to be significantly higher. You alluded at the end of your presentation to the possibility that early intervention is responsible for the lower cost. Are there other factors though included in that? Because I was very surprised by the final cost number.
Well, of course there could be, but in going through what we discussed in our meetings and the data itself, an important part of all of this is addressing potential cases of PTSD early, and that can happen through these. I think they call it living resources through the state now, or a peer-to-peer program where after a potentially traumatic incident, the individuals involved receive some form of either counseling or check-in, and not wait for 2, 3, 4, or 5 of these incidents to occur. So hopefully what that's doing is preventing a case that could end up, affecting a person's ability to continue working. You treat it early, you maybe have a few medical bills, you may not even lose that much time from work, if any time at all, hopefully, and it doesn't blossom into something bigger. So that's hopefully what's happening in these types of cases.
Quick follow-up, Senator?
You may proceed.
Thank you. So, it sounds to me like we've actually, what this presumption has done is not just lowered the cost, but actually improved outcomes and quality of life for the people who have the presumption. Is that a fair statement, do you think?
Yeah, I haven't spoken obviously to any of the actual individuals involved in these cases, but that would be where the data is pointing, right? We're not seeing so far severe cases where somebody's out of work for a significant period of time, can't return to work. That's when your costs get really high, of course. A lot of lost time, a lot of medical treatment and so forth.
Thank you.
You're welcome.
Representative Gear.
Thank you, Mr. Chair. Actually, my question, Representative Cuddy teed it up quite well. I'm curious as to whether you heard from the MMA any anecdotal stories or evidence about the nature and what they're seeing in the health of their workforces. And number two, if there would be any intention to confidentially survey folks just to see, I would just be curious to kind of look at the causal implications here and if this kind of a change did actually have that impact.
So the MMA did talk about this presumption and what's happening with, because they represent, as you know, counties, municipalities, smaller towns, and so forth. There's a difference between what a larger city and a smaller town might be able to afford in terms of prevention type measures. But certainly before the pandemic hit, I think there was a move to start implementing these peer-to-peer support type groups to try to find providers who could talk to folks about these situations. I think telehealth, telemedicine has helped out because it can be hard to find a provider in a certain area. I think there may still be some challenges finding providers who are willing to get involved in the workers' compensation system around here. But my impression from speaking with the MMA is they definitely take it seriously. Their members take it seriously, and they're trying to put into place programs that will ameliorate the impact of these types of incidents. Because unlike, of course, if you're working in a warehouse, perhaps you can put into place safety programs or provisions that will prevent someone from getting injured. In these cases, these employees are responding to things other people have done, right? So you're sort of left with dealing with their reaction to what someone else has caused. You can't prevent those incidents from happening, unfortunately, from their perspective. We haven't surveyed folks to see if that's happening. That's something we can think about doing, certainly through the board. We might do it through some of the professional organizations to get some feedback as to how those organizations think it's working for their members. That would probably be the best way to figure that out.
Great, thank you.
You're welcome.
Representative Bradstreet.
Thank you, Mr. Chair, and thank you, Director Rhodey, for being here. Thank you for this report. Got some good signs here. First one is a statement that alludes to what you were referring to about the pandemic. I'm just wondering out loud if the fact that the pandemic started in the last couple of years might have had some effect on the figures. And that's probably beyond the scope of anybody able to assess that anyway. But the question I do have is that in the last 2 years, and it's going back to what Representative Cuddy referred to as the lower costs, I'm wondering if we have any cases that are pending that may not yet be reflected in the last 2 years' costs. Are you aware of any of those?
I'm not. I don't know that any were pending before formal hearing. Those numbers will change, which is why I said they're approximately the same, because of there's a reporting lag here at the board. The first report of costs being paid comes in about 180 days, 6 months roughly after, then sort of annually thereafter. So those numbers will certainly change for the cases that are there, but this is a snapshot in time that you're seeing. With respect to the first comment you made about the pandemic, I think there likely is some impact from the pandemic, because we did hear during our discussions that, I'm sure you guys have heard the same thing, there's a lot of extra pressure on these first responders now, extra shifts, right? Just the stress of dealing with the people who may or may not be positive with COVID and so forth. So that may well have played a role in some of what's happened over the past couple of years.
Thank you. Are there any other questions for Director Rohde from the committee? Representative Drinkwater, followed by Representative Pepworth.
Thank you, Mr. Chair. Let's just dig a little deeper into some of this data you have here. The claims increased, but the payouts decreased. Have we have any explanation, such as perhaps a lot of these haven't been settled yet, and that's why the average has gone down? I'd just like to know, because having paid workman's comp as an employer for years, that just doesn't add up. That you got 140 claims on an average of $17,000 a claim, whereas you had 56 claims that averaged $53,000 a claim. You know, something just jumps out at me here that says there's something that is not right here. And obviously, as we add more groups to the presumptive, such as forest rangers and things like that, the costs are going to go up. So do you have any information on why that cost per claim has gone down?
So again, there may be, I'll double check this, there could be some cases that are currently being litigated that might end up being decided this year, next year, who knows how long it might take to get through. But it's also possible that you're seeing more attention paid to these types of claims, so more are coming in. A claim may be filed and denied, and if it's a smaller claim, it may never be pursued at all. The case just closes. The person decides there either isn't medical treatment and or lost time worth pursuing, so the claim just goes away. So that's a possibility, which would be an indication that claims are being filed earlier before there's a serious problem. That's certainly possible. I do expect those numbers will change, of course. As I mentioned, it was a snapshot in time in October of 21, so more recent claims haven't had a chance to mature yet. So that number will certainly be different if we were to run the report in a year than it would be obviously from last year.
Thank you.
You're welcome.
Representative Pepworth. You're on mute.
Thank you, Mr. Chair. And thank you, Director, for being here. I had a similar question to Representative Drinkwater looking at those figures. And so one possible explanation is more reports will be forthcoming, things will be processed, the numbers will change next year and the year after that. Are there other factors that could play into that?
Well, certainly. So the numbers of these types of claims are probably harder to predict. If you had a major natural disaster or a disaster of some sort where a large number of first responders responded, there would clearly be a spike in claims at that point. Again, just based on what we see from what's reported to the board, it seems as though if the cases are coming in and being reported and then not pursued, because we do see that with other types of injuries, cases reported, it's not pursued, and it just closes. It's just an indication that there wasn't something serious enough for the person to continue to pursue that claim. And hopefully what that's indicating is Because part of, I think, what was driving the desire for the presumption, and it's not just a presumption, obviously there's other things going on to call attention to this issue, is to reduce the stigma that folks feel in the first responding employment categories, right? So they feel comfortable bringing these kinds of claims forward. And if they're bringing them forward early, again, hopefully that's a sign that it's before anything major has happened and the injury can be resolved before the necessity for a lot of lost time or expensive medical treatment, or worst case scenario, you have to change careers.
Great, thank you, that's helpful.
You're welcome.
Chairman Sylvester.
And again, I apologize for not being able to raise my video, but having watched this since the 128th, and the data collection in the 129th, I'm very thankful for you to be here today, Director, to give us this report. We've been waiting for it, and I'm really glad to see it. My question is, I thought that I heard you say that one of the reasons for the decrease, and having talked to the professional associations, this seems to be their impression as well, is the fact that people are coming in earlier, when they're experiencing difficulty, when they're experiencing injury, and that the lost time is less, in part because of the work that the cities and municipalities are doing with peer-to-peer groups and et cetera, and the professional associations themselves. But it seems like that cost went down because people aren't out as long. Is that what I heard you say?
Yeah, that's what I'm hoping is the case. And I'm glad you pointed it out, because we did discuss this in the group, and you'll see those bullet points on page 3 about what we agreed upon, because it is the professional associations contacting their members, but it's also the municipalities and the counties and the entities themselves who would have to pay these claims, who are putting these plans into place and trying to address these issues earlier. So it's a multifaceted effort to, I think, ameliorate the impact of these types of claims.
Thank you, Director.
You're welcome.
Senator Garin.
Thank you, Mr. Chair. And thank you for being here today with this report. I was wondering, are there any statistics that would show earlier dates? How long did it take to resolve a case, so that we could see, are we only partway through the resolve question as it come up with other legislators? Is there pending cases that are going to be resolved? So if we look back at the data from before, how long did those cases take to resolve, related to how long they've taken to resolve this time? That might show how much of a window we need to have a better snapshot of if it's really saving or not.
Sure. So I just thinking out loud, I guess what we could go back and look at are a couple of different things. So by resolved, I would count either a voluntary payment without any kind of litigation, that sort of situation, or a consent decree, or a lump sum settlement. We can probably go back and see how long it took to go from cases that were initially denied, right? If they're paid right out of the gates, they're not going to show up on the list of denied cases, obviously, and what the time lag was between the knock and the payment, first payment being made on a claim. I can probably go back and piece that together for both periods.
Thank you.
You're welcome.
Thank you, Senator. So Representative Drinkwater.
Thank you, Mr. Chair. I can tell you from my own experience that MEMIC became very involved in being proactive to say, listen, seek early treatment. And I was in the automobile industry. Having talked to my fire chief here in town, he's telling me that your Workman's Comp Board is very proactive now in giving them information to saying this is the best policy to follow when there's a traumatic event that your firemen, EMTs witness. And I'd like to commend the board for being very helpful in saying, you know what, let's stop hiding these people behind, trauma. Let's identify it. Let's agree that it happens, and let's talk about it. And talking to the fire chief and some fire chiefs in other towns, just the firemen, particularly sitting around and talking about, trauma with a professional, like schools do with guidance counselors, et cetera, is been a very proactive thing. So I'd like to commend the board for giving information and saying, you know what, we need to be proactive in PSTD. So thank you, sir.
Well, on behalf of all the folks who do the hard work here, I appreciate that comment, and I will certainly pass it along to them.
Destigmatizing these things it goes a long way toward better health for all people. Representative Bradstreet.
Thank you, Mr. Chair, and I echo Representative Drinkwater's sentiments. Certainly. I have one question about, again, related to the COVID pandemic. Part of the cases that you analyze are cumulative. I wonder, is there anything other than PTSD if a person felt, the people I talked to are more exhausted than anything else? But is there anything else that, other than PTSD, that the cumulative effect of the pandemic may be listed under, or would it all be right here?
Well, we looked at anything that seemed like it would be PTSD because, again, we don't necessarily have a diagnosis, and it's early in the claim. Adjusters have a lot on their minds, and filling this out, they're not necessarily going to be exact. They're not going to have the diagnosis. So we might see PTSD. We might see the word anxiety. We might see heart palpitations. We might see stress. Those were all cases we thought would ultimately probably end up, those are the cases likely to end up with a PTSD diagnosis if they didn't already have it. I didn't see, when you look at the cumulative and event, sometimes it just said cumulative, so I have no clue what led to that description. Oftentimes there would be a specific description of what the person responded to as a firefighter, law enforcement, or EMT. I didn't see the words COVID come up in those. I think what I think the MMA had talked about this a little bit in our group. It's the added pressure of the extra hours, right? And I think that's just compounding the stress that in general first responders have been feeling. But I didn't see any specific COVID. I retract that. There may have been stress around having to get vaccinated or whatever. Those would have ended up in the other category that you would see here, but there were very few of those types of cases.
Thank you, Director. Again, thank you and the board for all of your work. I know that Chairman Sylvester, this is a big part of his legislative legacy, and he does have a bill that we have not yet scheduled a public hearing on, LD 1879, which will be in front of this committee. It's a proposal to repeal the sunset provision so that this can continue. And I think that some of the discussion that we've had today, especially the state Representative Guerin's question, will probably be come up again when we have a public hearing on that bill, whenever that happens. If there are no, Representative Guer has a question or a comment.
Thank you, Mr. Chair. And Director Rohde, I just wonder if it would be helpful, if at all possible, when we are getting ready for the hearing for LD 1879, to have a little more of the flavor of from MMA and other folks that would have insight here as to what they have seen the changes to be and how this legislation may have affected that. And I think that would help us as we're considering 1879. Thank you.
You're certainly.
Are there any other questions or comments from the committee for Director Rohde? Seeing none, well, we thank you, sir, for performing your statutory duty and being here. The information is extremely helpful. The report is on time, and we always appreciate that as well. And so with that, I say thank you and have a good rest of your week, sir.
You're welcome. Thank you.
You're welcome. Next up, we will have presentations from the Maine Public Employee Retirement System. We have 3. They're all statutorily required. I don't know what order staff wants to go in, so I'm going to promote everyone to the panel, and whoever speaks first is who we will introduce and take their report. So just give me 1 minute to do that, because I don't have a preference. I know they're listed in a order, but that doesn't mean they have to follow in that order. So here we go. It takes a few minutes sometimes for people to come through the wormhole to get here. So if everyone from Main Pers could turn on their cameras for us and introduce themselves, and then you tell me which order you'd like to go in. How's that?
Excellent. Good morning, Senator Hickman, Representative Sylvester, and members of the committee. My name is Rebecca Wyke, and I'm the new CEO at Main Pers, and it's my pleasure to be here with you this morning. Because I'm relatively new, I have brought reinforcements. So I'd like to introduce Mike Colleran, who will wave at you. Mike is our General Counsel and Chief Operating Officer. And Kathy Morin, who's probably known to you, is our Manager of Actuarial and Legislative Affairs. We do have 3 items that you've asked us to present this morning: the government evaluation report, the report on Social Security windfall elimination, provision in government pension offset, and also the FY21 valuation. And with your indulgence, when we do the valuation report, we'll also would like to give you a little update on Main Pers, including some of the legislation that passed through this committee that you have an interest in. But with that, I am going to turn it over to Mike Colleran to present the GEA report.
Thank you. Welcome all to the committee.
Thank you. Good morning, Senator Hickman, Representative Sylvester, and members of the Joint Standing Committee on Labor and Housing. Once again, I'm Michael Colleran, Chief Operating Officer and General Counsel at Main Pers. I'm here to present the program evaluation report filed by Main Pers prior to the November 1st, 2021 deadline. I'd like to give you an overview of Main Pers. Main Pers is a quasi-independent agency. We have just over 100 employees. We manage, as of today, $19 billion in investments and administer retirement and related benefits for more than 100,000 members and beneficiaries. We administer several programs. The largest and most important is our defined benefit retirement plans. There are 4 plans. Altogether, we pay benefits to approximately 45,000 retirees and beneficiaries every month from these plans, a total of over $1 billion per year. The largest plan is a state teacher plan. The second largest plan is the participating local district consolidated plan. This is a plan for 311 municipalities and other local government entities and their employees. Unlike the state teacher plan, it's a voluntary plan, so local districts are not required to participate in that. They can provide retirement benefits through other means to their employees. The third plan is a legislative plan that many of you are members of. And the fourth plan is the judicial plan. In conjunction with these retirement plans, we also provide a disability retirement benefit. This is to provide replacement income for members who are disabled and are permanently unable to perform the duties of their position. We currently have approximately 1,000 members on disability retirement. We also provide a group life insurance benefit to our members and to some of our defined contribution plan participants. There's currently 51,400 participants and retirees covered by that program. And finally, we administer the Main Start defined contribution program that consists of 3 defined contribution plans that we offer currently to just participating local districts, but we are seeking to expand that offering to other governmental entities who participate in Main Pers defined benefit programs. I'd like to touch on a few highlights of our operations over the last several years. First, the defined benefit pension plans are well funded. The funding level for the state teacher plan at the end of the last fiscal year was 82%. That's a huge success story for the state, the legislature, and several successive administrations. That plan in the 1980s was funded in the 20%, and through commitments that are reflected in the Constitution and otherwise, that funding level has grown to its now healthy level. The participating local district consolidated plan is also funded at a healthy level at 91%. And the other plans, the legislative and judicial plans, are funded at greater than 100%. We've managed this successful plan funding levels while maintaining contribution rate stability. which is very important, both to relieve funding, budgetary pressure on the employers, but also to protect benefits because budgetary pressures can lead to benefit cuts and COLA cuts. So we've set contribution rate stability as one of our leading risk factors and have managed our investments with that factor in mind. We have also steadily reduced the discount rate from 8.2% in the 1990s to its current 6.5%. By reducing that discount rate, we reduce contribution rate volatility. There's less stress on funding when there's market losses because we're not anticipating investment returns at high levels. In addition to those steps, we've also in the PLD Consolidated Plan did a restructuring in the 2018-2019 timeframe. Maine PERS working with the participating local district advisory council, which is made up of employers and employees who participate in the plan, and incorporated several reforms to make the plan funding more stable and to eliminate incentives for employers to leave the plan. As I mentioned earlier, that's a voluntary plan, and if employers decide to leave it, that puts increased funding pressure on remaining employers, which could result in a spiral for the plan. So those reforms are put into place in 2018 and have been highly successful. I'd like to touch on a few of our services programs. Our disability program that the committee has heard a lot about in the last session in the previous legislature has had over the years resulted in a lot of negative views by stakeholders and members that the committee has heard about. In response to those, Maine PERS on its own started to make changes to the program in 2017 to make it more transparent, to provide more information to members as they went through, and more opportunities to provide information and support their applications. And then we work with stakeholders in the last two sessions on the law that was enacted last spring that made further changes to the program, including eliminating the traditional medical board and replacing it with a medical reviewer. We have retained UMass Medical School for that role, which they've been performing now for about a year. And we've also incorporated other process changes, including a senior management review of any applications before they would be denied. Another area I'd like to touch on is our response to the pandemic. The pandemic caught us, as it did with everyone else, with some surprise in March of 2020, but we quickly transitioned from a workforce that was fully in the office to a workforce that was mostly remote. We had 80% of our workforce working remotely just a few weeks after the pandemic hit. We equipped everybody with equipment to be able to do that, and we didn't miss a beat in providing member services and protecting the security of our member information, which is a high priority to us. We do have personal and financial information on over 100,000 people, so we put a high priority on maintaining best practices to keep that secure. So we have weathered the pandemic well, and we continue to make adjustments as necessary as conditions change. We have made a lot of progress in all our program areas over the last several years, but our work is not done. Dr. White will talk about our goals and objectives at the end of our evaluation presentation. Those goals and objectives include continued preservation of trust fund, continued focus on security and integrity of information systems, expansion of the Maine Start participation beyond participating local districts, and cultivation of a member-centric organization so that we provide services to our members in a manner that works best for them and more efficiently and more effectively. With that summary of our report, I'd be happy to take your questions.
Thank you, Mr. Colleran, for that summary. Are there any questions from the committee at this time? I am going to call upon our analyst, Mr. Langland, to I was remiss in doing this before we started the report, but just for the committee members who may have not participated in anything like this before, or even for the general public who's watching, I'd like for Mr. Langland to sort of walk us through what our role as a committee is in analyzing this report. So, Mr. Langland, you have sent us something in our email, in our chat, that outlines this process as put together by the Government Evaluation Act and statute. So if you could just walk us through that, and then we'll turn to Dr. White, and then we will also involve a member of the public, as we all know, who has been very interested in presenting today to us what her experience is with a certain part of this report. So, Mr. Langland.
Sure. So after notifying the agency that you wanted to go forth with the GEA review, the agency then submitted its report by November 1st. And the statute mandate, well, it doesn't mandate, it says some of the things that the committee may consider in evaluating the agency is the extent to which the agency operates in accordance with its statutory authority, the agency's degree of success in meeting its goals and objectives for each program within the agency, the agency's degree of success in meeting its statutory and administrative mandates, and the extent to which the agency has increased or reduced filing and paperwork burdens on the public. As I said, this is not something the committee has to consider. It can consider a variety of factors when determining whether Maine PERS is operating within its statutory authority and whether it's needs any improvements or anything like that. So the report is due to the legislature on March 15th. And the other important deadline is that by February 1st, the committee had to start reviewing it. So we've hit that deadline. I will say that the committee does have the authority to submit legislation to make changes to the agency if it chooses to go that route. Sometimes the report backs are sort of more informal in that they sort of say, these are the things that we wish the agency would do, and the committee might choose not to submit legislation. And sometimes the report backs say things like, we want the committee to report back to us on this very specific issue by this very specific time frame. And the other option that the committee has, of course, is it could just simply write a letter to the legislature and to the agency saying that it believes that sort of no further action is required and that it is operating within its statutory authority.
Thank you, Mr. Langland. Any questions from the committee about the process itself? Seeing none, I will turn to Dr. White to provide her conclusions about this particular report, and then I will invite Ms. Susan Hawes into the panel to present to the committee and have a conversation with her about the issues that she has brought to our attention via email. Dr. White.
Thank you, Senator Hickman. Let me just say, I think the report speaks for itself. I think this committee knows well the process that we went through on the disability retirement services, where Ms. Hawes' concerns lie. I have read the testimony that she has provided to the committee for today, and let me say that I empathize. I am a lifelong public servant working for the state of Maine, for the university system, and now Maine PERS. And I have been a member of Maine PERS for over 30 years. I am also the recipient of my late husband's pension, who first went on disability retirement. So I have a great deal of empathy for the situation that she has been in. But I came to Maine PERS because I wanted to serve those who have served our state and done so honorably and well over many, many years. And part of that means making sure that Maine PERS is a member-centric organization. I believe we have good and well-meaning people in this organization that I have gotten to know a bit better in the 4.5 months that I've been here. And I think we have done a good job overall in meeting our mission. That said, I absolutely recognize that there are opportunities for improvement And it is very much at the center of the work that I want to do in my time at Maine PERS. And I will speak a little bit more to that when we talk about the goals and actions just before we cover the valuation report. But I do want to acknowledge that I have heard Ms. Hawes and that I am definitely committed on working on a number of those issues in a positive way.
And thank you, Dr. White. And with that, I have promoted Susan Hawes to panelist. This is, as she has said in her correspondences with us, an important day for her. So I will allow you, Mrs. Hawes, to introduce yourself officially to the committee and to the public, and I will give you up to 5 minutes to make your presentation. And then you also will be able to have committee members ask you questions as well. So the Zoom is yours.
Thank you. Good morning to Senator Hickman and Representative Sylvester, and to all the distinguished members of the Committee on Labor and Housing. Thank you for the opportunity to address Maine PERS's once every 8 years government program evaluation report. My name is Sue Hawes. My husband was approved for the Maine PERS disability retirement on September 12th, 2018, at the age of 48 due to complications from lifelong epilepsy. Our Maine PERS disability application experience caused so many concerns, and I'm so grateful to have these 5 minutes to address the committee today. I pray one or more of the legislators returning next session will meet with me and Maine PERS about what I say and the documents I provide today and other grave concerns I have about Maine PERS. Although Maine PERS has layers of supposed compliance points, none appear to audit Maine PERS operations outside finance and accounting. Meanwhile, Maine PERS is not operating according to its statutory authority. There are numerous instances I could discuss from our experience. For example, I communicated to the committee on November 17th in one of our appeals when I was preparing the Maine Superior Court case. Maine PERS could not produce the audio recording of our appeal hearing as expected, and the recording of the hearing, which we had a right to by law under Title V MRS 9059, and the recording was pertinent to our case. And I have included some documents, in this case, the emails from the Maine PERS Board Counsel and Assistant Attorney General and the Maine PERS System Advisor, describing how they don't retain the audio recordings. Maine PERS is violating the law by allowing the recordings of the appeal hearings to be destroyed by Deborah Brunn's reporting of Bangor, Maine. For the committee to get a sense of what goes on at a Maine PERS appeal hearing, I provided Darcy Kuchar's March 13th, 2017 testimony to the legislature. In particular, please see page 2, where she describes the appeal hearing in her husband's case, a veteran with PTSD. I also communicated to the committee about Maine PERS' ongoing reluctance to produce its disability procedural documentation. This reluctance is despite their response to my June 23rd, 2021 FOIA request asking for the disability procedural documentation. In response, Maine PERS stated that the disability team had, in their words, voluminous documentation. Ms. Morin would have to dedicate 20 hours of staff time, and I'd have to pay $300 to see any of the disability team's documentation. And documents 5 and 6 are the FOIA request and the response. In the fall, the committee agreed to require Maine PERS to publish its disability policies and procedures in this report, the 2021 Program Evaluation Report. And that was pursuant to the committee's statutory authority under Title III MRS 965K. However, Exhibit B of the Program Evaluation Report contains only the disability team's policies and practices, not its procedures. The 40 pages containing Maine PERS disability policies and practices are found at the end of the report at PDF page numbers 20 to 59. Despite the committee's request for procedures, Maine PERS does not include its procedures for the many critical processes affecting the rights of Maine PERS members and retirees, and the day-to-day work of the Maine PERS disability team interpreting and implementing our state's retirement laws. The agency's lack of transparency dates to at least 2009, when President of the Maine Senate, Libby Mitchell, got LD 1292 passed. Senator Mitchell is quoted in the attached news article, document 7, stating, information on how the retirement system came to a conclusion was not being disclosed by MPERS, and no avenue exists for retirees to make complaints about the system. Yet Maine PERS still remains a fortress more than a decade later, even though the first commitment of the Board of Trustees in board policy says their first commitment is promoting group responsibility while using the individual experience of members to enhance the proficiency of the board. And exactly the words of Maine PERS General Counsel's job description, second only to rulemaking responsibilities in the summary, his job is to, quote, developing statutory interpretations through legal opinions, reviewing contested member claims, and making recommendations to management. It also states that the General Counsel ensures the system is in compliance with federal and state laws, regulations, and rules, assists staff in implementing new procedures, drafts and reviews policies and procedures, and develop, implement, and enforce appropriate procedures and controls. I implore the committee to compel the publication of Maine PERS disability program procedures, ideally not just in a revised 2021 program evaluation report, but also in the future, online, ongoing, kept up to date publication of all Maine's administrative governments. Policies, practices, user manuals should be easily accessible to employees, members, and retirees. In fact, I was pleased to learn on Monday that the Board of Trustees Board of Governance manual is now available at mainepers.org. Lastly, Senator Mitchell's bill also added new requirements for the Maine PERS annual report to the legislature. I strongly suggest the committee consider requiring further informative statistics about both the appeals and disability programs at Maine PERS. Not all appeals are disability related. And you'll see attached in document 8, I've made suggestions as to some of the questions I have and would be interested in receiving answers on an annual basis for the committee to consider. Passed by this committee, LD 1644 became law in October 2021. The law eliminates, as Mr. Colleran says, the Maine PERS Medical Board. This was a huge step in the right direction to improve the disability program at Maine PERS. Thank you for passing that legislation this session. I so appreciate your time, and I'm happy to answer any questions that you have now or in the future.
Thank you, Ms. Hawes, for your being here today, for your robust testimony. And, you know, often members of the public will point out deficiencies and have no solutions. And so we certainly appreciate that you have taken the time to direct our work. As we have already said, we don't have to make any decisions today about anything. We have until March 15th to evaluate all of what's in front of us. And so again, thank you for being here and making this as clear as you can to us. Are there any questions for Ms. Hawes from the committee at this time? Seeing none. Again, I appreciate you being here. The lack of questions doesn't mean there's no concern. I think that these are very touchy issues, clearly. And the committee will absolutely deliberate whether or not we will take any action on what you request of us. But we would certainly like to do that when we can do that, and not necessarily in this moment. So since there are no questions, I would just say thank you very much again, and we will absolutely be in touch. I know you will follow our work.
Thank you.
And so you're welcome. Dr. White, would you like to, just for the committee's purposes, you've already really responded to her testimony, but I know that we have other reports to hear from you. So I will let you decide how you would like to proceed from here.
I think I'll reserve it. I said what I wanted to say before. I was hoping it would be after. I do want to acknowledge that even before I learned of her case and talking with stakeholders and talking with the staff and the prior executive director here at Maine PERS, there is a clear recognition of what needs to change culturally. I think we have good employees who are doing things the way they were always taught to do it. But it is time for a cultural change to happen, and it will take time for that to take place. But I will go over the goals and actions in a little bit more detail and try to give you what my take is on where we need to be over the next 3 to 5 years as an organization. So I'll wait and use my time for that when I have that slide in front of you.
Great.
Item on your agenda is the report in response to Resolves Chapter 84 on the cooperation of statewide retirement systems on the WEP and GPO. It's a pretty short report, and so it's a pretty short presentation that I have for you today. But the Resolve asked us to study the current and potential cooperation among statewide retirement systems affected by the Social Security windfall elimination provision and government pension offset. And I think you are all familiar with what that does, but I'm happy to answer any questions you might have about what exactly that is. But essentially, Social Security benefits get offset because state employees and spouses, widows and widowers of state employees who have paid into Social Security do not pay into Social Security during their public employment. And therefore, it is an equalizing provision that the Social Security Administration and the federal government have put in place. But it is often perplexing to public employees and sometimes harmful. And so I want to thank you for the attention that you have paid to it, both through this legislation as well as the potential new state teacher plan legislation. So I would just say that nearly all states have some public employee retirement plans that remain exempt from Social Security. While most of those are smaller local plans, the bulk of the employees, 6.4 million that are not covered, are under statewide plans. So this is a real issue. In our report, we outlined that there is already ample cooperation between retirement plans that do not participate in Social Security, and that is through a nonprofit organization called the Coalition to Preserve Retirement Security. This organization tracks federal legislation regarding changes in elimination of the WEP and the GPO. There is also, as there has been many times in the past, currently federal legislation pending that would address this issue. And in addition, I would point out that Maine PERS is finishing up its report on Resolve 66 and 72, which is a design for a new state teacher plan, which is based on Social Security. And I'll talk a little bit more about that later. Unless there are any questions, I think that does wrap up the report. We see good cooperation now. There is federal legislation pending, and you have another study that is coming up that would create a plan that would be based on Social Security.
Thank you, Dr. White. Are there any questions from the committee about the report, given all that we have heard from any committee members? Representative Gear.
Thank you, Mr. Chair, and thank you for being here. I'm sorry, is it Director White? Sorry, I want to make sure to get your title correct. With regard to the federal legislation, I think the difficulty that we have in the committee is really understanding the feasibility of that legislation passing in order to address this ongoing issue that has been a challenge for years and years. Is there any insight that you can provide on the prospects for that legislation, or is whether there is any likelihood of a federal level solution to the issue?
I don't think so. I'm certainly not an expert on the issue, Representative here, so let me just confess that up front. But there has been legislation on this off and on. You also got in materials, I believe, from the Maine Retirement Association, an update, which includes some other legislation. Apparently, Maine Senator Collins has also introduced some legislation. It is their belief that that may have the better solution and the better opportunity for passing. But this legislation at the federal level is not new. And so when an appetite is available to move that forward, I think is unclear to me, as I assume it would be unclear to many. So we have the opportunity, I think, and we'll talk a little bit more about that as we go into the next report to address that. But that's really, it is a group of stakeholders that are going to have to come together, employers and employee representatives, as well as, of course, all of you folks that will have to decide if the time is right for Maine to take action on this.
Thank you.
Are there any other questions about this report before we move on to the next segment of their presentation? Seeing none, please proceed as you wish.
Okay.
Thank you.
So I'm about to do the scariest thing you can do in front of a legislative committee, which is to share my screen. So I am hoping that is showing up for you. Can someone just acknowledge that they are seeing that?
It is showing up. I'm going to actually ask committee members if they don't mind to turn their cameras off. This is a really unstable environment. Unless you want to be seen by the public, I completely understand that. This is still a public presentation, and we know people are watching on YouTube, but it's very unstable. And so I'm hoping that now that we have a screen shared, people aren't paying attention to our Zoom faces anyway. And I would certainly ask that other than people presenting, just please turn your camera off. Thank you. Please proceed, Dr. Walker.
Certainly. So the next phase here is to talk about the 2021 valuation, but I did request your indulgence to talk a little bit about Maine PERS, since I am a new CEO here. And I wanted to start with the goals and objectives. Mike Colleran talked a little bit about them in the report. At the time the report was final, these goals and objectives were not finalized. This is something, a process that I began with the Board of Trustees, in part to make sure that I understood what they expected of me as the new CEO. But I also went through a series of meetings with all of our major stakeholders, employers and employee representative stakeholders, to try to understand what were their concerns about Maine PERS, what do they think we need to pay attention to, and this is where we landed. And the 5 goals really represent the long-term goals where we need to constantly keep our focus. So beginning with our fiduciary duty under the Constitution to ensure that we have a healthy trust fund that is there to support the benefits that we have promised to these public employees. Secondly, we have learned over the years that the stability of the contribution rates is also critical. It's important for employers, whether they be the state or the teacher, the school districts, because it can play havoc with the budgets when the contribution rates unexpectedly rise. But it is also important for our members, because when those contribution rates unexpectedly rise, the reaction is sometimes to cut the benefits. And so if we want to continue the promise that we make to these public employees, keeping those contribution rates stable is important from both an employer and an employee perspective. We are in the 21st century, and so security and integrity of our information systems has to be a major goal of ours to ensure that we meet. It is important because we need to protect the assets of Maine PERS that we hold on behalf of our members. It is important because we need to protect the personal information of our members. And it is important because we are highly dependent on technology in our work. And we might not be able to get out payrolls if our technology is not functioning properly. The fourth one is the cultivation of a member-centric organization. As I stated before, I think Maine PERS does a good job, and it is filled with good and well-meaning people. But it is time for a cultural change within Maine PERS that puts our members right at the center. And I believe this is going to be a major focus of the work. I feel pretty good about the work that has been done on the trust fund. Today, we achieved an all-time high of $19.2 billion, that's with a B, dollars. And when I applied for this position back in April, I will tell you we were at 16 billion. Certainly the economy has boosted that, but we have an excellent investment team and they are doing very well. I think we have developed a philosophy around the contribution rates that I just shared with you that is good. And I have looked pretty closely into the security of the information systems and feel confident, but believe there's room for improvement there. But it is the cultivation of a member-centric organization that I think deserves the most of my attention over the next few years. And one of the things that we're doing is we're bringing in a new position, a chief services officer, who I intend to hire as a change agent to help me move this cultural change through Maine PERS. And then the last one is the development of our stakeholder relations. As I said, it was a priority for me to meet with all of the major stakeholders as a new CEO. Those partnerships with our employers, those partnerships with our member representative organizations are critical to the work that we do. The objectives are really all legislatively related, and you have, as a committee, have driven many of them. But the first one is planning for the post-2028 full funding of the unfunded liability. That is sort of the opportunity that presents a potential public pension plan option that includes Social Security because of the drop off in those payments. But whether or not a new public pension plan comes into being, we have a plan that is maturing, both in terms of reaching full funding, as well as maturing in the sense that we will soon have more members in pay status than we do who are active in employment. And that means we really need to pay attention to our asset allocation and de-risking the plan moving forward. So that is a major objective. Responding to the recent divestment legislation, it is challenging, but I am committed to ensuring that we do the best job that we can to harmonize our constitutional fiduciary duty with the will of the legislature in the law that you have passed. And that is going to require a great deal of work on the part of Maine PERS, but I'll tell you a little bit more about that in a few minutes. We have that well underway. We also are proposing in our department legislation that Representative Sylvester is kind enough to sponsor, expanding the availability of defined contribution plans to teachers. Some school districts, many school districts, offer these defined contribution plans, but they have individual relationships with vendors. We believe Maine PERS has a superior product that we currently offer to all of the participating local districts. And we have school districts that would like to be able to partner with us to offer this to their employees. And then finally, the disability legislation that you passed last session also included exploring mandatory long-term disability insurance coverage. I do believe this is a critical piece in filling the gap in terms of the benefits that we offer employees, because there is a severe gap between when an employee may become disabled to do their job and whether or not and when they can require, when they meet the requirements for disability retirement. And so these are the things that are guiding my work. Our Board of Trustees adopted them in November, again, after a little back and forth over a couple of months to make sure that we had them right. It doesn't mean there aren't other things that we will be focused on, but these are the ones that are sort of driving my work and the work of the senior leadership team at Maine PERS. So I wanted to give you a quick update on the new state teacher pension plan design, as well as the divestment legislation. So beginning with the new pension plan design, this report in response to Resolve 66 and 72 was originally due December 1st. And we did request an extension till February 15th because we are working with stakeholders on this and we needed more time. I didn't get an official acknowledgement that we had more time, but obviously we're taking it, but we do intend to meet the 15th of February as the deadline. So the working group represents state and school employers, as well as representatives from the Maine Education Association and the Maine Service Employees Association. And we've been meeting almost weekly since September on this work. The resolves charge the working group with developing a new design for the state teacher public pension plan based on participation in Social Security. And there are a number of desired goals that the work group has come up with, but three critical ones are improving portability for employees who leave state service or leave service as a teacher, improving recruitment for employers that because of the GPO and the WEP may have some difficulty recruiting into positions from outside of state government or the public schools, and then the elimination of the impact of the WEP and the GPO. The report that we will be delivering will provide a high-level conceptual design based on Social Security with comparable benefits to the current defined benefit plan as was required by the legislation. The report will include comparisons to the current plan of member benefits, estimated costs to members and employers, the relative advantages and disadvantages of options within the design, and proposed plans and timelines for implementation. Because this is a high-level conceptual design, I think the next step would be to assess the interest in one or more of the options that are outlined in the plan, any modifications that you as a committee might want to see in that, and then if you desire to report out legislation that would call for a much more detailed study and implementation plan in order to move that forward.
Dr. White, if you don't mind, I just want to check in with the committee and see if they have any questions about any of this at this point, or going forward. If you do, just raise your hand and I will get to you as soon as it makes sense to call upon you. Any questions from the committee? Seeing none, please continue. Thank you.
I did want to preface this by saying I timed myself. There's only 10 slides I'm really speaking to, and it only takes 15 or 20 minutes to get through it. I tried to be cognizant that some of this, particularly what we're about to get into, is much denser than probably any of us really want to spend a Wednesday morning digesting. The next thing is a quick update on the divestment legislation.
Before you move on, I'm sorry, Doctor, it looks like Representative Gear does have a question.
And I appreciate your attention to time, Dr. White. But the timing on these, can you just refresh me on when we should be seeing the next steps on each of these items?
So on the state teacher pension plan design, you will get our report on that on February 15th, and it will be responsive to both resolves chapter 66 and 72.
Great, thank you.
The divestment legislation, we have convened what we're calling a divestment advisory panel, and we've been very fortunate to attract some major names from states that have had some similar experiences. And those are Brian Rice, who is the portfolio manager at the California State Teachers Retirement System, Deborah Spalding, who currently serves as the Chief Investment Officer at Common Fund Asset Management Company, but was formerly with the Connecticut Pension Plan. Elizabeth Gordon, the Executive Director of Corporate Governance at New York State Common Retirement Fund. And the panel is also joined by our own Chief Investment Officer, James Bennett, Deputy Chief Investment Officer, Zach McGuire, our General Counsel and Chief Operating Officer, Mike Holleran, and myself. We only have held one meeting, but it is already proven very fruitful in terms of the benefit that we will gain from the experiences of these individuals in other states. We do plan to hold a meeting for public comment so that interested parties have a chance to weigh in. But the outcome of the work of the panel is to identify the issues that must be studied and addressed in order for us to move forward. And we would use those issues identified to prepare a request for proposal to seek a consultant to help us develop what I think will be a multi-year approach to the divestment legislation. This work with the panel and with the RFP process should be completed before we need to come back to this committee with our first report, which is due on January 1st, 2023. And it's my hope that it will be completed a few months prior to that, so that any policy changes that need to be adopted by a board of trustees, that they will have that opportunity to have that discussion and to make those changes before our first report is due to this committee. Unless there are any questions about that, I'll move on.
Representative Drinkwater has a question.
Thank you, Mr. Chair. Apparently my memory is not as good as it used to be. Divestment legislation. Can you refer me to what law was passed to direct you to divest?
Yes, there are two. One that addresses fossil fuel divestment. It is Public Law 2021, Chapter 231. And the other requires divestment in private prisons. And that is Public Law Chapter 234.
So you're telling me that that legislation passed, even though we were told that we have no authority to direct you to disinvest or invest in anything?
Yes, the legislation passed, but it passed with the inclusion of language that qualifies the direction to divest as being consistent with our fiduciary responsibilities and sound investment practices. And I have no doubt that even in this moment in time, our ability, if we were to divest today, would absolutely bump up against the constitutional fiduciary duty that we have. And so therefore, we need to navigate how we can absolutely fulfill our constitutional fiduciary duty, but interpret the law to the extent that we can, consistent with that duty. At the point at which we can't, then we won't be able to go further. So although the law requires divestment by 2026, that exclusionary language acknowledges that that journey may not end in 2026, that it may be a much longer journey. Internally, we've been meeting on this weekly since I started at the very end of August, and we now have formed this panel. There are huge issues for us over the toe to work through, and I don't want to suggest that there aren't, but I also am a lifelong public servant, and I believe I need to figure out as best I can how to take the tension between the constitutional duty and the law and figure out how to harmonize those, and to the degree that we can interpret the law and implement it without violating our fiduciary duty, we need to do that. So my belief is there will be some movement, that the economy is going to shift over time. I can't tell you whether that's in 5 years, 10 years, or 15 years, but it's going to shift and new opportunities are going to present themselves. And I think it is incumbent upon us, because of the law that passed, to continually try to see how we can both fulfill what you have asked us through legislation and harmonize that with our constitutional duty. But it will not happen easily in the near future. But I think we will make progress over time. So that's about all I can say about this, because it is a daunting task. And that's why we've pulled in a panel of experts who have been grappling with these issues in their home states. And that's why we need one or more consultants to help us work on this as we go forward.
Thank you, Dr. White, for that answer. And Representative Drinkwater, we did a lot of work in a very compressed amount of time last session. And so we can all be excused from not remembering every bit of it. I believe, and Mr. Langland will correct me if I'm wrong, or any other committee member, the two bills were sponsored by Representative Maggie O'Neill and Representative Michael Brennan. And the Office of the Attorney General and the Office of the State Treasurer worked on language that would allow for these bills to move forward without running afoul of the Constitution. And so it was a fine needle that we threaded. And I don't remember if the chief executive signed the bills or not, but they did go into law. And that is what Dr. White is telling us about right now, that the work to make this happen in that on that tightrope, if you will, will take longer probably than we expect, but those bills did pass, and here we are. Please proceed.
Okay, so the valuation is completed on an annual basis, and every 5 years we do what's called an experience study, which informs the valuation. And both of those processes were completed before June 30th of this past year. And I wanted to start with the schematic because I think this is sometimes difficult to understand how public pension plans work. And so this provides a little bit, I think, of a way for you to think about how they work. So we'll start with the inputs to the public pension fund, which include those two valves that are in blue on the left-hand side of the schematic. And two of the major inputs are the contributions that employers like the state and school districts make into this plan, as well as the contributions that employees make, what is taken out of their paychecks and put into this plan. The third source of funding into this plan is our investment earnings. And that you will see is in the yellow at the top right-hand side of the schematic. When you look at the tank, which is where all of these valves are depositing funds into, think of the tank as the total liability for the benefits. So for all of the state employees and teachers, as of today, what we owe them in the future, because we promised them these benefits going forward, represents the total size of the tank. And what the green represents is the amount of assets in the tank. So from the contributions from employers and employees, from the contributions from the investment earnings, this is what we have accumulated. And there is a gap between the assets in the fund and the total liability. And the difference is the unfunded liability. And when we do the valuation to determine what the unfunded liability is, because in particular of the 1996 UAL, which has to be bought down by 2028, the valuation determines how much we have to open that little valve on the employer contributions. Is it set at the rate that it currently is sufficient to keep the amount of assets in the fund sufficient to meet the constitutional requirement to pay off that liability by 2028, or do we need to open that spigot a bit wider and let more money flow in, which of course would mean a higher appropriation for this purpose. So I hope that's helpful to you in understanding what we're trying to explain to you today. This is the valuation results for the state teacher plan. And I know that's a lot of numbers and a lot of words that some of you might not be as used to, but I'm going to try to break it down for you as best I can. I think everybody is aware that fiscal year 2021 was a phenomenal year for investments. If any of you have a defined contribution plan, you saw some major increases happening in that. And that was also true for Maine PERS as well as pension plans across the country. So at the end of June 30, 2021, Maine PERS experienced a 23.7% return on the market value of the assets. And you can see that about halfway, a little more than halfway down in the gray area. If you went all the way to the right, you would see the market value of assets is 23.7%. But the Constitution requires that we calculate these things on an actuarial basis, which uses a methodology that takes lots of things into consideration. But one of the things that it takes into consideration is what's called a 3-year smoothing. So we don't realize the full gain or a full loss in any individual year as a way of evening out the impact of those over time. That also has a positive influence on the employer contributions and what needs to be made to meet the unfunded liability. And on an actuarial basis, after you apply that smoothing and other things, you will see that the second line down in the gray area, the change from FY20 to FY21 was 9.9%. So on a market basis, 23.7%, but on an actuarial basis, 9.9%. And next year and the year after, we will still experience some of the gains from FY 2021 because of that smoothing. In July of last year, the Board of Trustees took advantage of these phenomenal returns and used them to lower the discount rate. The discount rate is what we expect to earn on the fund. And you heard Mike Colleran talk about the fact that that has been a consistent effort of the trustees to lower the discount rate. He talked about it being, I think, 8.2% quite a while ago, and it coming down slowly when opportunities presented itself. And high return years present that opportunity. So we lowered the discount rate from 6.75% to 6.5%. And yes, ordinarily when you lower the discount rate, it increased costs, but we used these exceptional gains in order to offset those costs in this current state. That is not to say that tomorrow or next year or the year after that, costs don't go up again. It's just to say that they took this opportunity to lower the discount rate. There are about 5 other states with pension plans that have similar discount rates, another 5 that are below. And I will tell you, we are the envy of all the other public pension plans, because those with the higher discount rates, they cannot achieve those easily year in and year out, or even on average, because the returns just aren't there without taking huge risks. And we have a plan that is maturing because it will be fully funded by 2028. And also because, as I noted, our members who are in pay status are going to be greater than the number of members in active status. And so that really means we have to think differently about how we de-risk this plan in order to stabilize it going forward. The most important takeaway from the valuation is that the funded ratio and the employer contribution rates remain essentially flat. So I'll point those out to you, in that the funded ratio, you can see it is in the first part of that gray area at the bottom of the first part, actuarial funded ratio. 2020, 82.4%, 2021, 82.1%, and the actuarial world with the size of our fund, that's virtually flat. And then if you come down to the very bottom line in the yellow area, you will see that the total calculated rate for the contribution the state makes 20.15% in 2020 and 21.72% in 2021. So what made those changes in the valuation? I just want to talk a little bit about that. This graph shows you, it starts in 2012, and you can see that on the right-hand side, by the time you get to 2021, the green area, talking about asset gains, is significantly bigger than all those other years. And the sort of turquoise area is also significantly better, which is the assumption changes. And the green area certainly represents the positive investment returns that we experienced in 2021. The turquoise area really represents the assumption changes. There's a little dark blue line between those two colors, and that's a very small liability loss. But the turquoise area is the one that deserves the most attention. And the major assumption changes were, number one, the 5-year experience study that was completed. Longevity has increased. People are living significantly longer, even than they did 10 years ago. And so the actuarial assumptions need to change, because if they live longer, they're going to be collecting their benefits from main PERS longer. And the other significant change is the lowering of the discount rate. That did increase the assumption changes. The net of the green and the turquoise areas is that it increased the unfunded liability by about 316 million total for FY21. So what do we do with the valuation? Well, as I said, the valuation determines how much the employer valve for contributions gets turned up if needed to cover the costs. And we've shown you that at least it looks like it's going to be pretty consistently close to flat. And this is how the rates get set. So next summer, we'll be working on the rate setting. And this valuation, we will take the liabilities. We will use the actuarial methodology to roll them forward to June 30th of 2022. We'll take the preliminary assets as we're developing the next valuation, And those two pieces together will be what determines the rates that the state will have to pay in FY24 and FY25. Now I just wanted to cover the funding history a little bit. You heard Mike Colleran in the program evaluation report refer to the success story. This is the visual of the success story. This chart goes back to 1991, which is 1 year after I started in state employment. And it goes right up to June 30th of last year. And the blue bars, vertical bars that you see represent the present value of accrued benefits. And the gray portion of those vertical bars represents the unfunded actuarial liability. When you look at the purple horizontal line, that's the market value of assets, and you will see that that fluctuates a bit more than the green line, which represents the actuarial value of assets. Recall that I told you part of the actuarial methodology is to smooth out the gains and losses over the 3-year smoothing period. And so therefore you see that that line is a bit straighter. You can absolutely pick out the recession from back in 2001 and see that first dip in the purple line in 2003. And then you can see the Great Recession starting in 2007 and really getting to the low point in 2009. By using that actuarial methodology, which is required by the Constitution, it helps to smooth that out. Now, for those of you who were around in 2011, you know it wasn't enough to keep costs from rising because there were some benefits changes that happened at that time. But overall, what you see is that really beginning in 1996, after the constitutional amendment went into effect, we have made huge progress in funding the state teacher plan. We've gone from a fund that was in trouble to a fund that is envied by other pension plans around the country. And then since we took a look back, let's take a look forward. This is a model that's produced by our actuary Chiron. And this model shows us achieving the current discount rate of 6.5%. So that's what our investments would have to return year in and year out to stay on track. I think we all know that that will not happen, that we will have years where we do better and years that we do worse. But overall, we are trying to manage our asset allocation in order to achieve that 6.5% consistently. And in this model, if you look at the top part of the model, you will see that in 2028, the actuarial value and the market value of assets now exceeds the actuarial liability when the 1996 UAL is paid off. That doesn't mean there aren't other UALs. There are, they get created every year and we have amortization schedules that we track, but that's the big one. And so we believe that by 2028, when the 1996 UAL is paid off, we will be substantially fully funded. The piece of the chart that's below that shows you contributions. So the yellow vertical bars are member contribution rates, which are set, and the green vertical bars are the state contribution rates. And once the 1996 UAL is paid off, you see this huge drop off from 2028 to 2029. The estimate of that is around $390 million that becomes available. Again, all of this is pending no huge market fluctuations one way or the other between now and 2028. And I want to point out two things. One, the fact that we won't have those huge contributions coming in from the state, that we have a mature, fully funded plan, that we know that we will have more members in pay than who are active in the workforce paying into the plan, means that we need to change our methodology about how we approach asset allocation and do our best to de-risk this plan, which will now be a mature plan. But that drop off in 2029 also represents an opportunity. Those funds will again become available to the state. I'm sure there's no shortage of uses for those funds, but certainly LD 1105, which was passed last session, which calls for the new state teacher plan design, looks at that as an opportunity for how we might going forward by into Social Security. It would not take care of people like me or Mike or Kathy or some of you who spent years not paying into Social Security while we were on the public pension plan, but it would help employees and employers going forward. So I wanted to be sure that you understand that's where the opportunity lies in terms of the study that will be coming back to you. And with that, I'm gonna stop sharing my screen. And our appendix, as I said, you should all have that available to you through your committee clerk, but the appendix has lots of other information in it. It has more historical views of the state teacher pension plan. It has more scenarios of projections going forward. What if we have a really down year in terms of a negative investment return? What if we have a really positive year? What if we have a year that goes bad and then goes good? So you can kind of see that, but still those payments go way down under any scenario. And then if you have an interest in the judicial, legislative, or the consolidated participating local district plans, there's also evaluation results in the appendix for you.
Well, thank you very much, Dr. White. Welcome aboard. Clearly, you have walked into quite some work. And I have to say, for someone who has, before this committee, had very little understanding of how all of this worked, that was a great presentation to bring me up to some sense of competence about the whole thing. Are there any questions from the committee? Representative Bradstreet.
Thank you, Mr. Chair, and thank you, Dr. White, for being here. Very good presentation. Appreciate it very much. I know a lot of lending institutions have to do a shock analysis of, if the economy should go south for whatever period of time and whatever percentage. And I know you try to create every scenario you can think of, but by law, are you required to do a shock scenario or a shock assessment of the viability of the system?
I wouldn't put it that way. I think the constitutional requirement that we produce this information on an actuarial basis is incredibly important for the work that we do. And because that is what gives you assurances that we have taken these things into consideration. So the process is extensive. Every 5 years, there's a full experience study where our actuary really digs into things. Like I said, longevity has really shifted over the last 5 years, and that's part of the changes in the actuarial assumptions that are in here. We do have a top-notch investment team, which focuses with the support of our board of trustees and a number of consultants on the asset allocation, and we are embarking on that process with the goal of de-risking the plan by 2028. What needs to be done in terms of where we are putting our investments in order to have a more reliable return. But as you de-risk a plan, you also have to bring down your expectation of what your returns are going to be. So lowering that discount rate was a piece of this. I would expect that we are going to be seeking over the next 5 years another lowering of the discount rate. I can't tell you exactly what that would be. We have to go through the process, but that work is beginning. We are going to be completing this spring a full asset and liability study as part of that work. So I understand what you're saying about, planning in the business world for the shock. I would say arguably we do that every day, but we also have a very stringent annual and then every 5-year set of processes that we follow in order to make sure that we are constantly paying attention to that.
Okay, very good. Thank you. Appreciate it.
Representative Cuddy.
Thank you, Senator. And thank you, Dr. White, for being here today and for all the presentations that we've had from Maine PERS today. I do not have a question, but I do just want to point out that I was happy to hear that you are considering your new hire to be a change agent and somebody who's going to work on the culture inside Maine PERS, because the testimony that Ms. Hawes sent to us, her supporting documentation, all of that paints a picture that I don't like to see. And it is my strong hope that Maine PERS is going to take this really seriously and look at the testimony that we heard today and other testimony that we've heard and take that to heart and really make some changes on it. And I know that I will personally be watching for that. But thank you very much for all of your hard work in preparing for today.
Let me just say thank you for that comment. And I have spent the last 4 months helping the board understand that this is what we need to do. And I would be delighted to come back and report to this committee anytime you would like to have me.
Thank you. Like I said, we will be deliberating all of this before we report out our report on the GEA as well. Representative Gear.
Thank you, Mr. Chair. And I would add my thanks to you, Dr. Weick. I think this was a great presentation. I will say for myself, it was very heartening to hear your awareness of the balancing act that needs to occur as we're looking at changes in our investment strategy and the constitutional requirement for keeping things solvent. So I was heartened to hear your awareness of that issue, and I look forward to seeing the work going forward on that topic. I did want to add, I think I'm following on with Representative Cuddy on a number of issues today, but the one that I wanted to raise is that I think it would be really helpful to hear from you, either now or at a later date, when you're looking at the change management program that you're hoping that your chief services officer will undertake. I would, as a committee member, would want to see some specific metrics and some specific systems and processes for measuring your progress on that change. That would include two things. One is the culture change that would be happening internally with employees and hearing their feedback. In my experience, it's certainly the case that often employees are the ones shouting into the wind saying, hey, this isn't working. We need to improve how we do something. And sometimes that can be hard for them to be heard. And so I think that hearing how you are listening to those concerns or ideas that are coming from employees, that would be super important. And then also, what systems and processes are you putting in place to measure members and your customers' real experiences with what's happening on an ongoing basis, so that things very specifically do not get to the point they've gotten to in a situation like Ms. Hawes's. Thank you.
So I will respond to that by saying everything that you just said has been part of the discussion that we have had. The work is in implementing it. We're starting with this strategic planning process that I described. So the goals and actions that were adopted by the Board of Trustees set the tone for that. We had planned today to kick off with our staff, the strategic planning process, but we had to move it because of the conflict. But this month we will be kicking off the strategic planning process. There is work that's going to be done by the senior management team that really focuses on the mission statement and our guiding principles and what is our vision for this institution. We will be asking all of our employees for input on that, but we are also asking them to then take the guiding principles, which will talk about things like transparency, integrity in the work that we do, the values that we as an organization hold, and we're going to ask them to themselves come up with the workplace values that operationalize those institutional values. My experience in leading strategic change like this in the past has been that if you want to shift a culture, you need to not offend people by saying what they've always been doing and the way they've been doing it is wrong, but instead invite them into a conversation so that they can internalize it, own it, and then be part of the change themselves. It takes a certain talent. I think we have some of that amongst our senior management team, but I think in member services, where that is our member interfacing unit, we need leadership that is experienced in this. And we actually finished the job announcement yesterday. So if any of you know of anybody, please let me know. I would be happy to forward their information on to our search consultant. But I see this as a leader who is experienced in change management, who holds the same values of public service that I hold, and that feels that we are here, we exist to serve the members. We can't give them benefits they're not entitled to by law, but we can do a much better job of educating them up front as to what their benefits actually are. We can do a better job, I think, of making sure that as they have to interact with us, that it is an easy process where they feel that they were able to navigate it in a way that made sense to them. And I don't like to hear testimony like Ms. Hawes I have ever in my career, but in any place I've ever worked, you always have some of those instances. And I think Maine PERS has gone a long way to respond to it, but I also see that there's a real opportunity for us to take this further. And I hope you will invite me back in future years to talk about our progress. I'd be happy to do that. I do think this work, I'm not saying there won't be progress in the next couple of years, but this kind of work takes 3+ years to really take hold. And with the right leadership in place, I think we can expedite that to some degree. But I would love to come back to this committee and talk more about it.
It's really good to hear. Thank you.
Yes, it's great to hear, Dr. White. Thank you very much. Chairman Sylvester.
Thank you, Mr. Chair. And I just want to encourage you as well that the documenting of your change, I think, will be key, because this is, as you said, is not an issue that is in a silo just at Maine State Retirement. I think it's a state government issue in each of the silos and departments and divisions, and and I think everyone's moving in this direction. And so your successes and challenges will be a great encouragement and a bit of a wisdom for other divisions and departments as they move forward. And this fight of having employees' voices be heard and doing what we all want to do, which is serve the constituents. So thank you very much for all of your work.
Thank you, Representative Sylvester.
Are there any other questions or comments from the committee at this time? Dr. White, thank you for accommodating our schedule. Clearly, you have told us that you were planning on doing something else today with your staff, but here we are. We would like to be able to have the time that we need to do our work in a fastidious way. This is our short emergency session, and before you know it, we'll probably all be forgetting what we did yesterday. So, so we appreciate you being flexible and versatile and coming here today and presenting very well, and also listening to the grave concerns that are expressed by Ms. Hawes and others who she may be speaking for without them even knowing it. So, you are new to this position, and we all must give you a chance to show that you mean what you say and you say what you mean. And we certainly will work in partnership with you to improve everything about Maine PERS going forward. So thank you very much.
Thank you, Senator.
You're welcome. With that, are there anything, I see Chairman Sylvester, do you have anything else to say, or is your hand still up from before?
Still up.
Okay, great. Does that conclude your presentation, Dr. White?
It does.
Well, then with that, we thank you very much, and enjoy the rest of the weekend. I know that Monday is a holiday. It's an okay day. The committee will not meet on Monday for that reason. We will begin our public hearings and work sessions on legislation on the 19th, next Wednesday. So prepare for a long day. Mr. Langland, do you have anything else for us? Oh, Representative Drinkwater.
Thank you, Mr. Chair. Did you give any consideration on holding hearings on Tuesdays and Thursdays, seeing as how we're not going to be in session in Augusta?
Thank you for the question, Representative Drinkwater. We have not done that yet. If we need to add committee days, we will. The plan is that we won't need to, but if we do, we will certainly, each day of the week, we could probably get approval to meet. But I do know that there are members of this committee who have other committees that meet on Tuesday and Thursday. And so we don't want to not have quorums when we're doing this really important work. But if we do need to come up on a Friday here or there, we will bring that back to the committee and get approval for that at the very least, because that is one day of the week that we are not currently authorized to meet and have not asked to meet. So,
thank you.
And you're welcome. Anything from you, Mr. Langland? So with that, we stand adjourned until next Wednesday at 9 o'clock. See you all then. And thank you very much again, Dr. White.
Take care all.
And your staff.